So greetings, friends and followers. This is Nurses Talking. I am Del Barzi. And as always, if you like what you see and hear, subscribe, leave us a comment and let us know what you think. Here on Nurses Talking, we speak to nurses anywhere in the world and at any stage in their nursing journey, from students to retirees and anywhere in between. And so today I'm very, very pleased to welcome Beverly Mazza. Beverly is a BSN RN, a certified whole health educator, health coach, and patient advocate. Combining her expertise in nursing with her experience in mindfulness and holistic health, Beverly is uniquely positioned to help clients with chronic stress make lifestyle shifts needed to live a happier and healthier life through a whole person approach. Bev possesses extensive healthcare knowledge and utilizes a distinct set of coaching skills to guide her clients through health behavior changes with kindness, compassion, and clarity. She founded Purely Present Health to inspire and nurture healthier daily habits for a mindfully healthy life. In her signature one-to-one coaching program, Mindfully Healthy, she teaches mindful approaches to stress management and health behavior change. Welcome, 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 Beverly.
Thank you, Dale. I'm so excited to be here today.
How are you?
I'm doing well.
Okay, and I really thank you for doing this. I appreciate it because I love to have nurses speaking to nurses and showcase nurses. So thank you so very much for this.
My pleasure. Really excited to talk with you today.
Okay, so the first thing I really always want to know from nurses is, why are they nurses? So why are you a nurse?
Big question. I actually came to nursing as a second career, if you'd call it that. So
Okay.
I would say I was always a very intuitive, kind, compassionate child. If you'd ask any of my family members and friends, was very introspective and observant. So it was fairly natural for me when I wanted to go to college to end up studying psychology. So that felt like a fairly natural fit to me. Very interested in human behavior, why we do things, how the mind works. So I thoroughly enjoyed that as my first undergraduate degree in psych. But towards sort of the end of that, I realized that I didn't see myself going into graduate work in psychology. And sort of on a whim, ended up taking a course in the adjacent medical school that was combined in the history of medicine. I grew up with my father as a physician, so I grew up sort of with healthcare, the background of my life. So it was a world I was very familiar with, but had no interest in going into. But in taking this course, it really sort of opened my eyes up into health, public policy around health, with a fantastic professor, and kind of, changed my whole idea of maybe what I would want to do, and led me into doing some clinical research when I was there in school. Ended up in the hospital doing like a diabetes research study, did a research study on like psychosocial effects on vaccine response. So started dabbling sort of in medicine and away from kind of the graduate work in psychology. So sort of my first job was actually in clinical research coordinator at a large oncology center in Boston. And I did that, and again, sort of immersed myself within sort of the medical world. And after about a year or so, though, as friends, colleagues were going off to med school and nursing school and social work school and public health, I just wasn't quite there yet. I didn't really felt a direction to go in at that point. So I left and I took a position in veterinary medicine because that's what I loved. I loved animals. So I sort of jumped shift and was like, I'm going to follow sort of my heart, and landed there for about over 8 years as a veterinary technician, or what you would kind of call a veterinary nurse. Immersed myself in that, loved it, and realized, though, as much as I did love it, though, I was thinking forward thinking and longevity of career, what could I do? And that had my wheels turning into nursing, which had my family sort of laughing, especially my aunt, who was a nurse, who was like, I told you this, 10 years ago. you could have done that. But really at that point felt like maybe I was ready, but I was a little nervous, at that point. Would be an adult learner. Could I do this? was very overwhelmed by all the prerequisites. So even though I had a bachelor's already, I knew I could go into one of the accelerated programs. There was still a whole lot of prerequisites, and a lot of them in some of the hardcore sciences that I didn't have to take. And I was intimidated by it. I really was. But my daughter was about a year old, and I decided to jump feet first in and start with what scared me the most, which was like the chemistry prereqs.
Oh, yeah.
I started that online, and it was difficult. I actually reflect back on that. My daughter, in her first year of life, actually was sick a lot, so it was a challenging year, and I was struggling. And when you think about people who influenced your life, my professor at that time in my first prerequisite really encouraged me to keep going and do what I could do, and allowed space for that. Otherwise, I might have walked away right then in that first course. So I took my time over that. I really did what I could do as a young mom, ended up having my son, and I did night courses, online courses, did everything I can to finally kind of land in an accelerated program, which I did, and did that program, and have never really looked back in my journey over this time and the different experiences so far I've had in nursing. So it's been quite a journey.
Awesome. Awesome, awesome, awesome. So question is, having come to nursing in such a roundabout way, doing research and being in veterinary medicine and all of that kind of thing, what kind of challenges did you experience?
Hmm. I think for me, challenges was getting over sort of what was a nurse, right? I feel like I had a very narrow view, and I think that might have held me back from even thinking about it. I look back at this, I had a very narrow view of nurses being kind of like doctors' assistants, and wasn't really educated on all that was and that could be as a nurse. And that took me time to learn. I think it was one of the reasons it held me back from really exploring it. So I would love to kind of educate anybody who's maybe interested in nursing and all the different roles and different aspects that they can learn about to get into nursing. One of the things that propelled me into actually being like, yes, I can do this, was when I was being like, do I really want to go into like a traditional nursing role? I didn't really think I would stay at the bedside, which I didn't, because I was always very more interested in forming really deeper one-to-one connections with people and working on the health promotion side. And I came across the Holistic Nursing Association actually early on. Before I went to nursing school, I was actually a CNA, and went to one of their conferences and was able to connect with all of these nurses and realize that, I could be a nurse, and I could also appreciate mindfulness and meditation and Reiki and aromatherapy and all these different integrative approaches. And it was finding that community that really gave me the confidence to say, I can be a nurse, and I can be whatever kind of nurse I want and kind of move forward with that, and not having kind of more of a narrower view, and not feeling like I was any less than a nurse if I wasn't going to go into it to stay at the bedside.
I'm so very happy that you said that, because that is really one of the goals of this whole channel, is to allow nurses to see. I want nurses to see nurses everywhere, not just at the bedside. And I should say just at the bedside. I should say not only at the bedside, because it's so huge, it's so vast, that we can do anything at all, and in every area that you may be, you're just as valuable as the nurse at the bedside. Yeah, so I'm so happy that you said that. So you did stay at the bedside for a little bit, though. You did do a little bit of bedside. What kind of areas was that? Did you work?
Yeah, so I worked in a telemetry floor, so it was cardiac and neuro. So that was my first position out of nursing school. Took it right off of my preceptorship. So did that for about a year. And in taking the job, as I said, like I figured longevity wise, I didn't see myself staying at the bedside. But what an experience it is, to be at the bedside, and the amount of growth I had and what I was able to learn is really invaluable, and has really actually informed my practice now, which now I'm working in internal medicine in an office, but I've had that experience and that understanding of what it's really like to be in the bedside and what patients are experiencing, and how it is to connect with other healthcare providers. And I feel like I can very much counsel my patients and relate and understand what's going on when they are in the hospital or when they've come home from being discharged, because I was in that world and understanding. So it's, it's difficult. It wasn't a place that I knew that I would end up staying in. And I left it a little bit sooner than I had expected, but my husband had a position where he would be traveling and gone in the night times. And I was working like a second shift, sometimes coming home at 1 a.m. with no family nearby. It wasn't an option for a working mom with young kids to have no one home at night. So I guess that kind of gave me my permission to leave maybe sooner than I thought I would, which was probably being there for about 2 years. So it was sort of an early retirement away from the bedside. Yeah.
But that's cool though. Sometimes, sometimes life propels you in the direction you need to go sooner than you think you're ready, but then it turns out that you are ready. So
yeah.
Yeah. So now you said you're in internal medicine, huh?
Mm-hmm.
Why internal medicine?
Yeah, so it wasn't, I wasn't like I left the bedside and I was like, I'm going to go to internal medicine, but I knew I wanted to do something a little bit different. So I wasn't necessarily looking to change into a different hospital or a day position. I really wanted to kind of get back to my roots of why I wanted to go to nursing school, which was really to be more involved in sort of the health promotion aspect. Like the crisis acute management, which it just wasn't suiting my personality. Like I definitely just wanted to make those deeper connections. And when I reflect back on my time in nursing school and even my time at the bedside, in the moments that allowed for it, was the deeper connections I was able to make with patients is really what like I still hold on to as a nurse. And so it really compelled me to realize that I want more of those conversations. I want to be part of people's lives because it's so important. And so where can I do that? And, looking around at different jobs, I knew I wasn't going to take any job, but I did see a posting for an internal medicine practice that was actually a private practice in concierge medicine, meaning the physicians had, split off from, a more conventional system. And so there was less patient, taking on less patients, longer appointments, and really kind of valuing the patient provider relationship. And I was very sold on that. So I kind of, went in and I've been there now for about 5 years. So
Awesome. And that is such a valuable thing. Having, a connection with your patient. It's more valuable than any medicine you can, prescribe or or give. So you became an entrepreneur and you created Purely Present Health. How did that go? First of all, what's your vision for that? What made you create it?
Oh, my vision. Yeah. So my vision, as I was thinking, obviously working in internal medicine, having that opportunity to have the relationships with my patients, which I love, but also realizing that there was a limit to what I felt like I was able to do as an office nurse, as far as supporting people around the health behavior changes, especially dealing with chronic illnesses. So being able to kind of do more and be more helpful than wants you to eat better, or you need to start exercising, or, you're really stressed out. Why don't you do something for stress management? But a lot more of that was very more like prescriptive, like, do these things, and not necessarily having the space to be able to kind of coach people on, well, how are you actually going to do this? Like, what is going on in your world? What is impacting you? Because we all quote unquote know what we're supposed to do, right? I mean, my patients quote that to me all the time. Like, Bev, I know what I'm supposed to do. I'm just not doing it. And that's where I felt like that extra step was needed. And I was like, I feel very called to be able to do this to help people sort of outside of the traditional like practice office model. My background, again, I was always interested in holistic nursing, being part of the Holistic Nurses Association. And I decided I really wanted to get more training in sort of holistic health. And that led me to the National Institute of Health to do an online program for nurses, which was certification as a certified whole health educator. So really looking at someone's health, from 5 different aspects, a whole person approach. After I completed that program, I was like, I can infuse all of this into my day-to-day nursing practice, but I want to do more. And I was like, what can I do? I was like, I'm going to start a business, and I'm going to kind of use my background in holistic health and sort of my passion for educating around the impact that stress has on our bodies. As I always say, there's that emotional component where people know they're stressed and they feel frazzled and they're anxious, but there's all that kind of subtle, silent effects that are going on the, changes in our blood pressure and how it's affecting our blood glucose levels and, difficulties with sleeping, all these subtle things that people think, oh, I'm just stressed. When my stress is gone, all this stuff will improve. But there's always a level of stress that we're all experiencing all the time. And I say it comes in waves, but what can we do to help sort of mitigate this and manage that? So it brought everything together for me. And my background in mindfulness was sort of what really kind of propelled me forward to create a program that said, let's kind of combine managing our stress with our other health behaviors. So I teach a lot on stress management and mindfulness and meditation, and then nutrition and movement and sleep as well.
Yeah. I'm glad you talked that you mentioned stress, and you mentioned that there's always stresses. We always have stresses, because very often when you talk to people about stress, when people mention stress, they mention the big stresses, they mention the negative stresses. But many people don't seem to realize that some positive things are stresses as well.
Absolutely.
And we're not paying attention to that. And so we know what we're supposed to do, and you're providing the how we do it.
Yeah, that's where I think really like that coaching piece comes in too. It's like you have enough people in your life telling you, do this, don't do this, things like that. So it's really having that conversation with people and to connect with them to take it beyond that. Because as I say, like anyone can Google anything and find out, what I should and shouldn't do. But I really find like when you can step into someone's world, you really can have a greater understanding, kind of coach them around what some of those barriers are. And some are more simple than others, about, you can do like habit stacking and things like that, but some that go a little bit deeper. I mean, even kind of, coaching in a traditional nursing role around, why someone's not taking a medication, it's not necessarily as simple as slapping them with the label of a non-compliant patient, which I know as nurses, a lot of us cringe at that. So it's like, okay, that's not what it's about. But a simple conversation with the patient, well, what is it? And it's like, oh, well, it could have to do with maybe how their day is structured. And it's as simple as habit stacking onto something else. But it could be because, oh, it makes me feel in this way that I don't really like. Or, there's definitely more to the story. I can't put it. There's so much more to learn about it than simply saying, they're not taking this medication. They should be, like, they're not compliant.
I know. When they never told you that they were going to be compliant anyhow. Well, so how what does your client base look like? Is it mostly male, mostly female, a mixture of both, older, younger, cross section? What does it look like?
Yeah, so I feel like in like private practice, definitely focusing on more like midlife. So I'd say like, 40 to 60. Some of those times I feel like with 40 is a little bit of a magic number of when things kind of catch up to people. So that was sort of reflected in what I was seeing in internal medicine
Yeah.
was things that people quote unquote were getting away from or they could get away with. Um, starts kind of catching up with them. And that might show up as weight gain that wasn't there before, but oftentimes it starts showing up on lab work a lot in cholesterol levels, blood glucose
Yeah.
level,
Yeah.
non-alcoholic fatty liver disease. So we start seeing that a lot in sort of this, midlife time. And also I think the pressures of stress at that time, people, whether or not, if their kids are a little bit older, but, maybe at the peak of their career, and there's just a lot to manage. And I feel like a lot of times people put a lot on the back burner without kind of like actively addressing it. They feel like they'll get to it later. So yes, very open to working with both men and women. I know a lot of health coaches in the space are, focus on women's health, but I really enjoy working with both men and women.
And that you talked about that midlife person, and really, even if you look at someone in midlife and you think, oh, their life is going perfectly, there's so much going on. As you mentioned, many times their children are older. They have older children getting into high school, getting into college, this kind of thing. They're looking toward being empty nesters. They have teenagers, then they have parents, and they're kind of the sandwich people, and and again, the career thing, and so there's a lot going on with people in that age group. And sometimes we just accept it as well. That's the way it is, and not really know how to cope with it. So
Yeah,
it's a
and I
huge
feel like
thing.
Yeah, and I feel like there's a lot, and maybe because I'm in that age group of middle age, there's just I feel like a lot of like introspection, like sort of as well, of people kind of reflecting back. And I don't like to
Yeah.
use the word midlife crisis, but I think a lot of people reflecting on like, well, who am I? What am I doing? Like there's just, there's changes. I think
Yeah.
there's a change in maturity level and forward thinking that wasn't there in your 20s and 30s. So I think it's great. I love the direction it's taking me in. But I do feel like it is a shift. It's definitely a time period where things are changing.
Yeah, yeah, yeah. And for some people it's a tectonic shift.
Yes.
Yeah. So, what's your vision for this company of yours? How big is this vision?
My vision, how big? My vision, I mean, honestly, is to try to help as many people as possible. And I think that sounds cliche, but I really want people to be open to the possibility and understanding that to embrace being healthy doesn't have to be such a chore or such a difficulty, that it doesn't mean having to be on yo-yo diets and, losing and gaining weight constantly or killing yourself at the gym. And that there's space to create a healthy life that is just a way of being instead of like a way of doing. That's personally how I was able to kind of make my own shifts, as somebody who was always doing like the worried about how much I weighed and, what diet could I go on. And I'm exercising. Now I'm not exercising for 3 months. I'm such a failure. Why can't I not do this? And all of that guilt and that shame cycle, and just almost just teaching people and guiding them into relaxing into it. And I think once you can really appreciate and find things that you enjoy doing and really have an understanding of how foods are impacting your body and how much better you can feel eating like more of a whole foods diet. And I don't prescribe any particular diets or, follow any particular ways of eating other than really a whole foods based approach to eating. But that, it doesn't have to be so difficult. And I want to stop hearing people be so down on themselves about, I'm the right track, or I'm off the track, I'm off the rails, on the rails, because that makes for a really difficult life. If you're in this for the long road, I really want to empower people to just see themselves as a healthy person. And that doesn't mean that, you can't have, delicious
Yeah.
things and do things that might not be the most healthy. But there's room for that, because when overall you take an approach to live a healthy life, there's space to be able to maybe do some of those not so healthy things sometimes. And the body is resilient and can do that. So I'm just hoping to kind of be there for people and also just be a safe space for people to talk within the healthcare system, which I know can be rushed and hurried. And a lot of people, it's probably the number one thing I hear is I didn't feel like the doctor really listened to me. I felt like they were just treating me like everyone else. And so to be a healthcare professional that can sort of represent a different side of that, I feel really strongly about too, because I want people to know that, what they say and how they feel really matters. And, when I talk to people and they say, oh, I'm on this medication and this thing's happening to me, but who knows, the doctor said it's not related to XYZ. I never want to dismiss that because, we don't know, like it might be,
Exactly.
we're going to think about it. Like maybe this
Yeah.
is a thing, or you're telling me, you're doing this now and this is the way you feel. Like, I feel like people like to sort of say to me, you might think I'm crazy, but, and I'm like, no, I
I
don't.
don't
Like,
think you're crazy.
I want you to speak this. I want you to say this. I think this is really important to consider.
Yeah,
So helping people kind of find a voice in that way as well.
yeah, yeah, yeah. You mentioned mindfulness a lot, and that's a word we're hearing a lot use these days. What would you say mindfulness is?
Mhm. I love the definition of mindfulness. Everyone has their what they like to say. I mean, I feel like
Yes.
mindfulness to me is sort of like moment to moment awareness, non-judgmentally. And that's the big one, I think, non-judgmentally. So it is being within the present and being with what is, in a non-judgmental way, but that doesn't necessarily mean in a way that's acceptance. So it's not being dismissive of saying that, I'm experiencing everything and it means like it's okay and like I agree with it. But sometimes it means that it is the way it is and it's seeing it the way it is, and there's an acceptance to that, and when there's an acceptance there can be like a
Yes,
release,
there can
and
be. Mm,
not so much holding on to what should be. There's so much pain I see with people holding on to what should be or what should have been.
mhm,
And um, I really, for me, I dabbled in mindfulness and meditation for many years. It's really been more in the last several years where I feel like I really kind of dived into the teachings of it. I did take a mindfulness-based stress reduction course, and then since then I've sort of immersed myself in different mindfulness communities. I'm currently like in a teacher training certification program, again, to just sort of deepen my knowledge and my own practice to be able to teach people what I think is a really helpful skill across all aspects of our life, and in particular our health. I know there's a lot of research going on, and I think that's fantastic, and studies and whatnot on actually specific conditions. Hypertension I
yeah.
know is a big
Mhm,
focus of the effects of mindfulness. And I know there can be a resistance from people to actually sit and meditate, and I thoroughly respect that. But I think it's an important thing for people to, even if they're not going to kind of show up on a meditation cushion, is to be mindful, as I say, is a way of being. It's how you sort of move through life. And it has been so helpful for me as I kind of make sense of my life and my world. And it's helped me be, I think, a happier, a calmer, a more compassionate person.
mhm,
And if somebody's open to that, I just want to kind of be there and help kind of facilitate their own learning process of it. Because that's what it is. When you show up to it, people have expectations, they have wants. Meditation is going to quote unquote make me less stressed, or I'm going to relax and I'm never going to have any thoughts and things like that. And
mhm,
a lot
mhm.
of myths to dispel around that. But I think for somebody who's open to it, with some skepticism, that's always healthy. That's a perfect person, I think, to give it a try.
Yeah, 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 yeah. You mentioned people holding on to what was, or they what should have been or could have been. Um, and recently I have started to realize something. There was, I don't know if you've ever seen the movie Father of the Bride.
Yeah.
Um, but in that movie, and in that movie, what struck me very recently actually about it was there's a scene on the day of the wedding where the wife says to the husband, I think she wants him to change his tie. And he says, yeah, but if I change the tie, then I have to change the shirt. And if I change the shirt, I have to change the pants. If I change, I have to change the jacket. And at the first time or second time I saw this movie, that just struck me as funny. And the other day, it struck me that it's more than just funny, actually. That is life. Because
Mhm.
when you did something, especially something that you thought maybe I could have done it differently. But in order for you to have done that differently, so many other things would have had to change. Your mental state would have had to be different. Your emotional state would have had to be different. Where you actually were standing physically would have to be different. So many things would have to change. So perhaps don't beat yourself up about the choice you made or the thing you did, because all the other things around you are what contributed to that.
Mhm.
So yeah.
Yeah.
I just started realizing that the other day, actually.
Very true.
Um, what advice would you give to someone who wants to be a nurse? Having come to it from with so many different experiences, what advice would you give to someone who wants to be a nurse?
Advice. I would say kind of going into nursing with a truly like compassionate heart. Um, and also having to have a little toughness to that as well. And that's more dealing, I think, with the institution of healthcare as it is, to be
Yeah,
honest.
yeah.
um, in any capacity, even being outside of the hospital environment, which has its own challenges. That doesn't go away. Even working in an office, healthcare is the way it is right now.
Hmm. Hmm.
And those are definitely challenges to kind of be aware of. And I think not getting kind of bogged down with the frustrations of that, but really holding kind of in your heart that you're in this to help people and be truly compassionate and knowing how vulnerable people are, when they are discussing their health needs and their conditions, and just really honoring that. Because otherwise, I mean, whether you see, burnout or compassion fatigue, things like that, whatever they want to call it, um, whether you stick to nursing or you don't, it's going to just make for a really long career. If you're
Hmm.
not sort of initiating it for the reasons of like truly being there for people, and how I've seen it as a nurse, like what a privilege it is to have been with the patients I have been with for really their most intimate moments, whether
Yeah.
they're moments of life or death or family conflict or seeing them at their lowest points. Like it's
Mhm.
such an immense privilege, some might
It
say,
is.
depending on, how you take it home and process it yourself as the caregiver. But when I reflect back on some of these stories I've had with nurses, and I'm sure other nurses can echo those same sentiments, it's so powerful. You're like, wow, like me as this stranger, who's not
Exactly.
this important figure in their life was oh so important in this
Yeah,
moment.
yeah,
That's really
yeah, yeah. And sometimes because of where they are, they share so much with you that they don't even share with the people who are closest to them. And they trust you to hold that, and not just to hold that for them,
Mhm.
And that to me is really is huge. It's huge. It's, as you say, you use the word privilege a lot, and it is. I agree. Absolutely, it's a privilege. And so I have another question. I have realized that I can recognize nurses anywhere without anybody ever telling me that they're nurses. I can recognize them. I started wondering what was it I actually saw? What was the quality I actually saw? And so I started asking other nurses,
Mhm.
what is the if you could describe the most recognizable quality from your perspective of a nurse in just one word, what would that word be?
Problem solvers. I would
Problem
say
solvers. Okay.
even
Okay.
creative problem solvers, if I can use another
You
word in there.
absolutely can. You absolutely
Mhm.
can. Creative problem solvers.
I
Okay,
think
that's true.
so much of what we do as nurses is problem solving, whether it's with for our patients or within the institutions that we work in. And I think a nurse, even you take her outside of her quote unquote role as a nurse, I think that extends into how she
Yeah,
carries herself in her day-to-day life.
yeah.
um, that, if in a situation comes up, if there's a nurse there, I think there's a very, we're taught a very systematic way to kind of go through a process of, A to B to C to D to get us somewhere. And I think that's an essential skill for a nurse. And I think you can recognize it. It's the way of thinking, really. It's like a thought process that we go through. And it makes me laugh sometimes because it echoes back to me when I first went into nursing school and our professor was saying, I'm here, we're here to teach you how to think. That has stuck with me, and that has been so true. And that has been uniform across any aspect of nursing that I have done. It is that critical thinking and that creative problem solving to come to a solution or do the best we can in maybe less than desirable conditions as well.
Indeed, indeed, in less than desirable conditions sometimes. Indeed, indeed. As you said, problem solver, it kind of brought something back to me. Several years ago, I became a director of nursing, and initially, Although in the same facility, I had been the assistant director, which meant that I had insight in what it would require of me to be the director. When I did take that job, initially I felt I was out of my depth. And until I changed my position from director of nursing to firefighter. And I actually put a fire truck on my desk. I said, because every day what I'm doing here is putting out fires.
Yeah.
Until I changed that thought in my head and had that little fire truck on my desk to remind me of that. That is when I became comfortable in the role. So yeah, problem solvers indeed. Yeah. Oh, Beverly, thank you so very, very much for this conversation. It's been such a delightful one. Thank you so much. And I love your mindfulness. I love your mindfulness vision and viewpoint. It's such a necessary thing because in our world is so fast paced that being mindful of where we are, how we think, what we do, how we affect others, sometimes gets away from us. So thank you so much for that.
Thank you for having me. I really enjoyed chatting with you and being able to connect like this. So thank you for the invitation.